Okay, hi there. Good morning, good afternoon, everyone. We're just 1 minute past the hour, so I'm going to give folks, I see that a number of participants have joined us. Thank you so much. I'm going to give folks another minute or two just to sign on, and we'll get started shortly. Thank you. Okay, I think we'll get started. Hello, everyone. Welcome to the webinar today. My name is Nicole Bodner, Communications Lead for the Canadian Partnership for Tomorrow project. Welcome, thank you for joining us for today's webinar. It's titled Environmental Health Research Opportunities through CANUE and CPTP, Today and the Future. So we're pleased to host this third webinar under the University of Toronto as CPTP's Coordinating Centre, and we're hosting it today in partnership with the Canadian Urban Environmental Health Research Consortium, also known as CANUE. Before we introduce today's speaker, just a few really quick housekeeping items. We will have lots of time today for questions following the presentation. To ask a question, please use the Q&A button at the bottom of the Zoom window and type in your question. Our panelist, our speaker, will make sure to read the questions while he's answering them, or before he's answering them. If we can't get to all of the questions, please reach out to us by email and we'll be happy to connect with you. Our email is info@partnershipfortomorrow.ca. And finally, the slides from today's presentation will be available in both English and French on the CPTP website following this webinar. Okay, so please allow me to introduce today's speaker. It's Dr. Jeffrey Brook. Dr. Brook is CANUE's Principal Investigator and Scientific Director. He is also an Assistant Professor at the University of Toronto's Dalla Lana School of Public Health and also in the Department of Chemical Engineering and Applied Chemistry. Dr. Brook has more than 25 years of experience as an Environment Canada scientist working at the Science Policy Interface. He is one of Canada's leading experts in air quality, recognized at all levels of government as well as academically for his substantial contributions in air pollution health research. Dr. Brook has led scientific assessments to inform policy both nationally and internationally and has advised multiple stakeholder groups in shaping policy. So we're thrilled to have him with us today. Dr. Brook, over to you.
Hi, thank you. Can you hear me well, Nicole?
Yes, I can.
Okay, great. Thanks very much for the invitation to do a webinar today for CANUE. It's been an excellent opportunity, I think, for both of us to partner, to enrich both of our efforts and certainly to enrich the CPTP platform. CANUE is a consortium that spreads all across the country with many members, And we've been funded largely through the Environmental Health Signature Initiative of CIHR during this time, and that's really made much of this possible. I want to start just giving everybody a background on CANUE. Many might have heard of CANUE from other presentations or an earlier presentation I gave at a CPTP workshop in Toronto, but I'll sort of give an overview of our main objectives. We have sort of three short, medium, and long-term objectives that focus us towards where we're headed. So in the short term, our main goal was to compile and distribute nationally consistent environmental data. Medium term was to enable more research to increase knowledge on how multiple environmental factors related to the urban environment individually and in combination affect health. And then in the longer term, clearly to want to have impact that can inform decisions about how we shape our urban environments. We have focused on urban areas, given the large number of people who live in urban areas and the opportunity to modify our urban spaces for health benefits. And we work from this diagram that's on the right there that shows a picture of Ottawa, but indicates here the number of factors that are influencing how our cities evolve, from population and economic growth to increasingly weather and climate change challenges, but also from the upper standpoint around the socioeconomic status of populations and the life stages people are in. But they are all interacting together to affect health. And one of the main areas of our interest are around how they influence environmental exposures that people experience, such as air pollution, level of physical activity they might be able to obtain, noise pollution, access to food, healthy foods, and so on. So we sort of work from this framework to consider how various exposures in the urban environment interact. As you can see in the box on the left, but also here in bigger pictures, we have over the last while been focusing on a number of different domains of environment. So one important domain that is at the smaller scale, what we call sort of neighborhood factors. So those are things in the socioeconomic domain and the access to food domain, in the areas around how walkable neighborhoods are, or the opposite of that as one realm. Air quality clearly is an important aspect, as is noise pollution. Climate, increasingly important in terms of areas that might be higher potential for flooding or for urban heat island effects. We're learning more and more about the benefits of green and blue spaces, and CANUE is working in that area. And transportation is clearly an overarching aspect of our urban environment that interact with many of these and is very important to consider. I hope you like maps, because CANUE is really a lot about maps. So we're working at generating the consistent environmental data that is something that you can map or look at spatial surfaces or spatial patterns. And we distribute our data along those lines at the 6-digit postal code level. That makes it easy to link to most health population databases that have that level of resolution. And 6-digit postcode level is really quite important for the types of environmental effects that we're thinking about, as opposed to, say, the FSA only. We're also going back in time wherever possible in terms of generating these data as early as the early 80s. And for cohorts like CPTP, which are ongoing as the follow-up continues, we aim to be doing this on a regular basis in the future. I want to talk a bit about the data in the data portal for those different aspects of data that I mentioned that we have now acquired. And what we have is, through the website, I think a very easy to use portal that allows you to see what data are available, to browse the data on a map browser, to put in requests for data. So at this stage, it's not just a grab and download as you like, but you need to put in a request to CANUE, which is then sending you back more details. And then once you've got the approval through the data request, you can begin to start to download data and the different domains that might be of interest. And as part of this data, we've done a considerable amount of curation of metadata. And so the metadata information is all available there for you to see in terms of some aspects of how the data were generated, who the primary source has been for the data, how to attribute use of the data when you're publishing. And you can see here some descriptions of what each parameter is, and some maps that show aspects of the geographic coverage. So you can see this all through the CANUE data portal that's had a number of development and refinements over the year, and it's working quite well. That also allows you to view the distributions of the data across the CANUE data set, how many postal codes we've got coverage for, and to switch to maps to look at maps, such as here I show maps of greenness quintiles across different parts of the country. Now we map to postal codes, which clearly are much denser in populated areas and become larger as you get into the rural areas, is the way you see this map showing it in terms of dots in the middle of postal codes. So you're able to, with this browser, to look at different times by using the slider bar, and also to zoom in to any area you would want. And I think it works quite well and quite effectively to give people a really good flavor of the information that's available at your fingertips. One of the main objectives for CANUE was not just simply to gather the data, put it there, and have it for people to use in a standardized way, but to really facilitate use. And so for that, we have partnered carefully with CPTP and a number of other major health data platforms, particularly the CLSA, the Longitudinal Aging Study, and the Childbirth Cohort, to directly link our data into those platforms so that those who are going into CPTP, for example, or one of the sub-cohorts of CPTP to request some of the outcome data or any data on the subjects, are able to request some aspects of the CANUE data in a pre-linked form at the 6-digit postal code level. So that is a way that we can really facilitate use of both platforms by having this at your fingertips. As you can see, there are a number of administrative health databases that hold our data. The Manitoba Center, Population Data BC are two that have it and it's active. We continue to be working very closely with ICES to facilitate CANUE data into that platform as well. And we continue to try to think about other platforms that might use it, like the RDCs with StatsCan. And that's, as you can imagine, not an easy endeavor to be able to work through all of the agreements that need to be done to pull this off. Now, I want to talk a bit about some of the science and where we can place CANUE and who we partner with. So this is a list of priorities from a paper that came out in Environmental Health Perspectives last year, talking about the area of spatial life course epidemiology. In some ways, I see those as the new buzzwords for what was and still is used often as the phrase the exposome, and how we all have our own unique exposome that evolves from pre-birth all the way through our lives, and describes our integrated environmental exposure, and is sort of related to, in some aspects, the phenotypes that we all exhibit, and potentially the chronic disease that we may have. Now, spatial life course epidemiology, I think, takes a step back from the exposome, thinking about the domains of the internal exposome and the different forms of the external exposome, where internal is something that you can see from a biospecimen like a blood sample, whereas external are things that are aspects of your exposure that we have to characterize based on information from, say, CANUE data, or from information on questionnaires about behaviors that are more general but external to what you can see in a blood sample, for example. Now, spatial life course epidemiology, I think, focuses mostly on the external exposome and those things that are around the variables that are related to where you live. Now, this group that got together in a meeting and produced these priorities listed several of them, and I bold the first two because they speak pretty well directly to what CANUE is doing. So in a lot of ways, we had CANUE going before this came out, and so we can really see here how we're right there in the forefront of what are seen as priorities to advance this realm of epidemiological research. So why life course? Many of us are probably, not unfamiliar with the Doha principles and the common origin and early life of chronic disease. And this diagram here is articulating in more detail the early life periods from pregnancy to birth to early life in more detail, and exhibiting the concept of how early in life, if you're on the path towards normal development or high risk development, there may be greater opportunity to intervene and change one's path from being on the red line back to the green line at that stage to improve the potential for healthy outcomes later in life. Or the other way around, exposures can have a bigger impact early in life and put a person on a path towards chronic disease development later in life. And that's then a target for modifying a person's environment in a broad sense. As you get later in life, then the opportunities to maybe cross from one to the other become more challenging under this hypothesis of common origins and when you look back early in life. Now, in terms of CPTP, you can see that this yellow bar is generally where the population's been picked up and is beginning to be followed. So we're kind of past that point in time of early life and able to say, hey, people in CPTP, we now know what you should be doing to change your early life outcomes. So that ship has sailed, but CPTP certainly offers a lot of opportunity to look back in time in individuals to learn more about this hypothesis and how we can use it to benefit health individually and in terms of public health. And also remind us again about thinking about the importance of exposure windows back in time. Very little is known when we think about environment and a person's current condition as to when an environmental exposure might have happened that had the greatest impact. Or is it continuous throughout this curve, or are there particularly sensitive windows? Certainly here, we think that sensitive windows are early in life for intervention or for effects to happen, but they're not the only windows that are certainly important in what we end up with in terms of some of our phenotypes of disease later in life. But it's important to always remember the challenge of exposure windows and the challenge of quantifying exposures at these times in the past. So as I mentioned, we're all about lots of maps, and there's pictures here on the left of some different types of maps and a list of a range of the types of data that are in CANUE at this stage. So, as we've got our systems up and running, we've been able to collaborate with researchers across the country and to have them share their data and for us to then manage it and make it available. And beyond that and what exists, we continue to work with teams within CANUE to advance new sources of data, such as information on noise pollution, food environment, and other microscale urban features. So there's a lot still happening to advance the type of data that are available. I mentioned again that data is found its way into CPTP, child, and CLSA to really facilitate work across the whole range of types of questions that researchers might have on environmental health, from working more on the clinical outcomes and having the environmental data available, or getting down into epigenetics or genetics, and also into bringing all this into bioinformatics platforms for more discovery. So I think we're a key element of this whole picture for research and new discovery. Back to the sort of life course approach. So it's by design that we've really targeted the largest birth cohort in Canada, child, which also includes in that study the parents. The parents have consented to also be studied through administrative data, and any information that we've characterized about the children in terms of their address often apply to the parents, which maybe a maximum is 7,000 parents more into the early years of raising a family. But then that continues on to somewhat later years, where the bulk of the CPTP participants are, and then even later in terms of the bulk of the CLSA participants. So we have a virtual life course research platform sitting in front of us here in Canada that I think is tops in the world for discovery. It's not an individual that we've followed from before birth now up to old age, because we know that will take a long time and it's impossible to answer the questions we have waiting that length of time. We'll all be retired by then. But we have this virtual opportunity to study different stages of life and look back and forth between them for common features, I think, to lead to new understanding. And here in this diagram, sort of showing the life course, are just a number of call-out boxes that are indicating some of the studies that are ongoing and have requested CANUE data at different stages in the life course. There are many, and I'll summarize them at the end, but as you can see, they are spanning the life course, and that's really exciting to see that our vision of making data more available is paying off in terms of people knowing it exists and starting to use it and move us forward in Canada in environmental health research, as was the vision of CIHR and having this initiative to begin with. Now, I talked about exposure windows, and one aspect of being able to quantify an exposure in a previous time window in a cohort like CPTP is to know, where they've lived throughout as much of the life course as possible. Where were they born? Where did they go to school? Did they change jobs at different times? These are important things to try to know, and it's very onerous to ask a person to complete this information in questionnaires when they're in a cohort. I know, when I'm asked those things, it's never fun, and it can be very tiresome, and you can't remember things that well. Some of the CPTP cohorts have acquired that data directly, but with CANUE, we've had the opportunity to do that through administrative data in partnership with Statistics Canada and their social data learning linkage environment, SDLE, where they have acquired for all Canadians who have filed taxes the address part of their tax claims, which is updated every year as they file taxes. So we're able to get year by year many, many Canadians' addresses. And some don't move, some only move within a fairly small area, and others move across the city or across the country. But with this partnership with Statistics Canada, who contributed their efforts and received funding from Health Canada also to do that, to support the CANUE endeavor, we're now at the stage of generating time-varying exposures by year for, at this stage, I believe, 3 of the cohorts we've done it for. You can see here what they are. The BC Generations Project has taken up the opportunity to generate residential history, as has the OHS and the Atlantic Path Study, while Cartesian and Alberta's Tomorrow Project have not yet taken up that opportunity for residential history. What that's enabled in terms of the exposures that have been seen to be of interest, as we've discussed with CPTP and CANUE, are there in the table on the right. And you can see the different time periods with which now data are linked to the subjects. So in requesting that richer environmental exposure data in CPTP, what you would receive would be not just one measure of the person's, say, air pollution exposure around the time that they were recruited, but also year-by-year exposures going back, you can see, to these earlier times, as earlier as 1984 right now for something like traffic air pollution, which is typically indicated by NO2 or nitrogen dioxide. So this opens up lots of possibilities, and I'll touch upon that a little bit again later. Despite there being, quite a wealth of data standardized for the country, linked into multiple cohorts, and I think leading the world in what we're doing here in Canada, we're really still probably only having a glimpse of people's integrated life course exposure. Getting at exposure, given that we're all unique, is very complicated and spans across many, many different domains. So there's still much more to be done. And Here's some examples of newer data that are coming in. We're now in the process of working with data sets from Environment Canada that are allowing us to look at UV radiation across multiple years, to think about things like monthly mean vitamin D dose or the ultraviolet radiation dose, and are now working on getting that into the form ready to link with CPTP. Because we do work closely with CPTP to have different time periods, ideally even annually, whereby we update the data that are in the database and add new variables as they're available, so that it's constantly evolving. We continue to enable more research. Other data that we've been doing is, we know that there's a great interest in traffic air pollution directly in terms of how close do you live to a roadway. So we now are mapping across all of Canada by postal code information on their traffic exposure based on proximity to roads. So here are postal codes in terms of the proximity to roads, proximity to major roads, proximities to local roads, and many of you may know of the Lancet paper that came out a few years ago now by Hong Chen when he was at Public Health Ontario, looking at dementia and traffic air pollution or proximity to roads, and that work continues to have a lasting impact. And these are great variables in their own right to start to ask these questions, because it's pretty straightforward to compute these variables, although a lot of crunching. So now CANUE puts these at everybody's fingertips. Other things that we're working on are going beyond greenness to proximity to blue space and water type, which can have a range of different benefits to health, are coming along the lines. And some of those variables, like the road variables and others I'll talk about next, are useful in their own right, but also the building blocks for newer exposure metrics that we continue to think about and try to develop. Other building blocks that are in CANUE that we're working towards having available would be not just roads, but the National Pollution Release Inventory of Environment Canada has the locations of emissions and point sources all across the country, which we're building into things like our sulfur dioxide and nitrogen dioxide air pollution surfaces, but also making available the knowledge of these locations and emission rates for consideration directly in studies. There are more and more pollutants that are measured by satellite that I'll show some examples of that we're bringing in to have available for research. The land use regression, or LUR, are models that have been used to develop things like the traffic air pollution exposures for nitrogen dioxide or ultrafine particles, black carbon, so on and so forth. Those road proximity variables I showed, they're also building blocks for the next generation of LUR models. And the new area that we're really moving into is the use of high-resolution visual imagery, whether it be from street view or from satellite imagery, to get information that we've almost never had before. And that's a sort of exciting new area that now can bring standardized data not only across Canada, where even at that level, GIS data varies from jurisdiction, and it varies even more between Canada and the US, but to have common data sources globally. So that's a new area that we're partnering with more and more groups to be able to do. Other building blocks that we've invested some time in are back to the childbirth cohort and starting to look much more closely at the interaction between neighborhood and children physical activity. And I think that will help us better understand measures of potential for physical activity and ways to structure our neighborhoods to get our kids moving more and more. Noise pollution, I mentioned, we have teams working on that. There are models available upon request for Montreal, Toronto, Vancouver, and Halifax. And from that, we're launching to more national data sets. But right now, they're at only these cities. So we haven't really made them widely available because we try to really focus on what we can do nationally at this stage. But that's coming, probably also tapping into newer tools around imagery and high-resolution models using AI techniques to link noise data to various physical features. In terms of satellites, as I mentioned, there's more than NO2, SO2, and PM2.5, with PM2.5 being used extensively in research around the world and a major indicator of air pollution in the global burden of disease efforts. But you can see in this table here, there's a range of others that are available, plus growing outputs from models of ground level ozone. And in CANUE, we've been spending time to try to bring them together to not just one map of one pollutant, like this example of PM2.5, or nitrogen dioxide across North America. And these are generally PM2.5 1 by 1 kilometer scale, or NO2 is 10 by 10 kilometer, or ozone is also 10 by 10 kilometer. But to bring them together into multi-pollutant chronic pollution exposure surfaces through things like principal component analysis. This is an example of a multi-air pollutant exposure index, which if you compare again back to PM2.5, you can see how it brings in additional aspects of air pollution that may be affecting our health. I mentioned the imagery that's becoming available at a range of resolutions. CANUE houses data right now that's at 3-meter resolution for much of Canada, and working with that to derive new indices from greenness to road networks to buildings. Scott Lichtenthal, Marianne Hatzapu, and Mike Brower wrote this paper talking about the potential in this area that came out a year ago or so. So we're much into that area. One of the early aspects we worked on was the use of Google Street View. That's something that people are publishing more and more on, is what can we learn about areas from Google Street View? We've adopted the Green View Index that MIT developed, and with many, many images on Street View across Canada in our archive, we're able to look at using visual imagery processing software to isolate areas that might be greenness, as you can see in that example of a panorama below. To then look at the percentage of green within a view within different parts of Canada that can augment our greenness that we get from above from space. As you can see, that these can speak to many different aspects. Greenness can relate to allergens or shade or influences on microclimate, promotion of physical activity through greenness or through other aspects of the features like sidewalks, curbs, bike lanes that we begin to see, or from the imagery more on traffic, for example. And all of these are being now mined from the imagery using AI imagery processing techniques. Here's a paper that some of the CANUE staff worked on early on to compare the street view to more traditional measures of greenness that might be of interest. We are right now focusing on using imagery to extract roads, to extract locations of buildings, and to do more work on land cover features. Here's an example of the work that Maddie Shustari, who's one of our programmers in CANUE with a background in image AI work, has been doing, where we can generate here a series of tiles and images, match them up with the learning data from the roads from below, and then move ahead to developing the models to be able to then process any image for roads. There are challenges like trees, of course, they obscure the roads. We have to compromise to some extent. But here's an example where a small number of tiles trained the model, and then it was applied for all of Vancouver to generate this from imagery. It looks very much like the reality. And now we can do this pretty well anywhere, which in the past, with the variability in GIS data sets, was more challenging to do it in a standardized fashion. There's a zoom in of the Vancouver area. What else are we doing with the CANUE data besides advancing metrics and working closely with health data platforms for environmental health research? Well, we're asking more about our urban landscapes and areas that are of integrated poorer exposures or poorer environments, sour spots, or the sweet spots where things are coming together for a very favorable environment. So we're mapping some of those. We're also looking at how that interacts with SES to look at areas where there's particularly acute inequities in terms of environmental exposures. And we're also trying to make the data more readily available through a mobile-based application called the Good Score. So I'll give some examples of that. But I also first want to give a call out to the CANUE team, because this is clearly a team effort, not to mention also all the cohort, the consortium members. And our leader in much of this work is Eleanor Seton, the managing director, who's based at University of Victoria. But many others, many of you will know Danny Dalla, who's worked very closely in the linkage with CPTP. I mentioned Maddie Shrewsbury, Evan Seed, Mary Speck, based at U of T, and Shailesh Carroll in satellite data expertise. So this is certainly a team effort to pull this off. We could always use more people for sure. Here's an example of a paper that Danny Dalla is leading, and we're working on with him to look at the sweet spots and sour spots. In this case, this is Toronto, and the yellow or the orange shows residential areas within Toronto where the NO2 traffic air pollution is in the upper tertile, and greenness and walkability are in the lower tertiles, to sort of call these sort of the sour spots, and the green where they're in the more favorable setting. And with this sort of information, we can start to help guide urban planning decisions to address the areas where things are particularly challenging for the populations living there. We can also overlay on that information with respect to socioeconomic status. In this case, we're looking at areas in the lower categories or the higher categories of actually material deprivation, and then how they interact with air pollution, to target, again, more about where are there sort of environmental inequities within our cities. And we're able to, of course, do this in all locations in Canada to really help target our efforts towards making more equitable, more healthy cities overall. I mentioned the good score. So the good score is our attempt to try to get this information out to people's fingertips in a very easy, friendly way. So we've got this mobile web-based application that allows you from your smartphone or a tablet to access a range of CANUE data. It's in prototype form now. We've been working with a company in Victoria to do this. And as you can imagine, since we're calling it a score, we're combining different aspects of our data together. You can see there right now, we've been experimenting with the walkability or the active living environment, traffic air pollution, areas of higher potential for extreme heat, smoke pollution, meaning PM2.5, and greenness. And the challenge, of course, is if you're doing a score, how do you really weight these, and can you? And that's something where we decided at this stage, it makes more sense to give the users the ability to weight it how they want. So I'll back up here. Part of it, of course, is to educate people. So as people are starting to use this app, and we're testing it with different students within U of T who have taken it out as a major project, and we'll start to test it in other groups if we can bring in additional funding through opportunities like the Public Health Agency of Canada. But part of it is, of course, is to provide knowledge to people. So there's buried in it information on different variables. We can target it to different audiences. And then, as I mentioned, the user right now is able to weight each of the different variables that are in there themselves. And in this case, you can see you can get the first open page where the weights are equal, but you can customize it. So here's an example where they said, I don't care about anything besides the active living environment. And so they've put that one to the top and the others to the bottom. And then we can see here in parts of Toronto how that lays out across the different neighborhoods. And they can get a score for their specific postal code, but also look around them all the way out to the sides of Canada on maps. So I think as we go forward, this can have applications also in work with urban planners and other public health specialists and even advocacy groups to meet their needs more directly. And I think it's really a new era of having more and more information like this available. Finally, sort of back to a link for CPTP. And one thing that I've talked about with the leads of CPTP for some time is when is it, or will it ever be ripe for us to go from what's great now, online questionnaires of data, to actually engaging people within the cohorts to use their smartphones to actually even provide more information. And we know that there's talk about how you might use smartphones to get more information on people's diets, and that's a very challenging area to characterize for nutrition. But there's much that can be done in the realm of CANUE to enrich what we have with respect to people. And CANUE has the technology, partners have the technology. We've been investing in how to take people's GPS data and where they move around, such as in this map here, and then not just look at their home address in terms of what's by their home address and the CANUE variables, but to be able to integrate across all of our data along their daily activity routes. So, for example, we could, for any individual who would be willing to share their data, and we know there are challenges around privacy and concerns in that area, but if there are people who would want to share the data for the good of this research, we're able to now articulate their air pollution exposures along their daily commutes to add that important third component to air pollution exposure, with 1 being their home, 2 being their work or school, and 3 being their experience in their mobility as they move around their city, their neighborhood, whatever it might be. So this is something I think we want to hopefully continue to explore as we continue to turn CPTP into the best cohort in the world. Some other upcoming outputs that we're working on, I showed the sweet spots and sour spots that we're getting ready to publish soon. But we have this CANUE data for all of Canada, but we also have it uniquely for CPTP. So we're able to do some comparisons, and we intend to do this over this next year to assess the exposure patterns or gradients within the CPTP cohorts versus, say, all Canadians within selected or relevant demographic groups. So we can ask the question as to, okay, here's what we have, what everybody's worked so hard to build in terms of the CPTP platform, and here's how air pollution varies across that cohort from high to low. Is that representative of Canadians at large or Canadians that are within the same age of the CPTP cohort? To give us an idea as we use CPTP, are we studying how representative of the population? We know there's often challenges in getting everybody across the whole spectrum into cohorts, and they're often usually biased towards a little higher income groups, for example. But we can still say, okay, even with that, are they still seeing the range of exposures that most Canadians see? And that's important insight to have. We also, as I mentioned, have the residential history data now linked up for a number of variables for 3 of the cohorts. And we're working with Trevor Dummer and Larry Frank and at UBC with the BC Generations cohort to look at each individual's trajectories of exposure back in time. And we can assess the potential for us to develop future studies where we would explore how a person's health responds to modifications in exposure over time. So how many people are in, say, BC Generations who during the period of CANUE data and the period that would be impacting their health moved, for example, from an area of low walkability to a high walkability, or vice versa, or low to high air pollution. And then ask the questions whether or not those exposure modifications have changed their health outcomes for the better or for the worse. And looking at these changes helps us, I think, build stronger causal evidence for environmental impacts on health. We also continue to want to look at the interaction between, in the BC Generations data set that we've now built with some CANUE investment and BC Generation investment and in contributions of some of the best walkability surfaces in the world that Larry Frank has developed for Vancouver that cover different times, to ask the questions about who is moving from the more to the less walkable areas over time, or vice versa. What demographic groups are they in that are moving, say, to more walkable areas or less walkable areas? What SES groups are they in that are leading to these movements to these different areas? Because it's very important to understand that to start to crack into this question about selection bias in our epidemiological analysis. So coming back to the point around spatial life course epidemiology, I highlighted the first 2 at the beginning that CANUE was right on target in addressing. at the national level, and of course with partnerships internationally. We can even do this broadly, consistently internationally. But if you go through that list, you can see that we've got sort of check marks along essentially all of it that CANUE has been contributing to. So I think our CANUE and our team and all the cohort members, or the consortium members, are really onto something that is at the cutting edge of where things are at in environmental epidemiological research today. We know that there is much more that we want to do with improving the type of data CANUE can provide the CPTP and other users. I touched a bit upon our work with AI machine learning model development, but those models are only as good as the training data that you have for that work. So there's certainly more need for more training data to really take that as far as it can go. We need updated models of detailed air pollution within cities, because many of the models are old, and we scale them to different time periods, but they do need periodic updates, and that's lacking. I talked about members of cohorts participating in data collection. So I think it'd be great to harness their participation more. We're doing that in child. There's no reason with the proliferation of smartphones that we can't do that in CPTP. I talked about selection bias and why people might move to different areas. More work on that is important. The walkability or active living environment is not the same for adults and kids. That's something that we could definitely improve upon and characterize areas in terms of not just walkability, but say playability for kids. It's been not possible to do residential history in the CLSA cohort, so that's coming. We'll have that soon. And there are also, I think, opportunities to work with cities and neighborhoods that know about interventions they've done in terms of changes in infrastructure, say investments in transit, that are also significant changes in impacting the population that we can then look at evaluating whether they've had impacts on health. But right now, we have not had the opportunity to start to derive those types of exposure metrics in a standardized way. I think that's potentially an exciting opportunity, as is bringing in exposure metrics that would look at regions that might have experienced a disaster, like a big forest fire, like Fort McMurray, or flooding and other extreme weather events, where these events have not only their acute impacts, but the potential for lasting effects on the population. And we have the ability to, I think, generate those types of maps also for people to continue to look at in terms of their health implications and chronic disease and other factors. Food environments are also areas where it's been difficult to use the available more proprietary information that's there. This is a metric that can change rapidly. So we're investigating, again, the imagery techniques to try to look more at food environment as an example. And just to wrap up, again, with respect to CANUE, so we started in 2016, building essentially from scratch, knowing what some data were available, building the consortium, building the partnerships, and then as we got the data more available and started to become more known, and CIHR has helped a lot with secondary data analysis calls that have helped target CANUE. But you can see here in the graph on the right, our growth in the number of data requests and studies that have been acquiring CANUE data. So I think we've seen some pretty exciting growth, and there's certainly no reason why, if we stay current, that we can't continue to grow and provide more and more data to get into even more detailed questions. So I'll wrap up there and want to certainly thank the range of organizations that have provided funding, provided help, provided data, and of course the CANUE team as well. They're listed in green. So I thank everybody for their attention, and I'll stop here and turn to the questions on the screen. I'll stop also for a minute to take a breath and see if Nicole wants to offer anything.
Awesome. Thank you so much, Jeff. Yeah, let's take a short pause here. So to those who joined us a few minutes into the webinar, just let me remind you that if you want to ask Jeff a question, please use the Q&A button at the bottom of the Zoom window and sort of type in your question. I see that we have a few in the queue now, but please feel free, everyone on the webinar, to add their questions now. If you have suggestions and ideas for future webinar topics, I invite you to email us or connect with us at any time. Our email is info@partnershipfortomorrow.ca. A reminder also that today's slides, today's presentation will be available in both English and French on the CPTP website following the webinar. Jeff, I do see a few questions in the folder, so I'll turn it back over to you if you're ready.
Okay. I see a question here. There's only 4, so I'm looking for more. But I see one about the mapping technology to differentiate between different types of air pollutants. And I showed some of the maps that we were doing in terms of satellite-related data. And much of people's attention are on ozone, fine particulate matter, and nitrogen dioxide. And CANUE has brought in sulfur dioxide, which is more related to different types of industry that's in there. And then within certain cities, there are even more and more pollutants like benzene that are becoming available. Of course, the big challenge is that this is outdoor, so it doesn't speak to the indoor penetration of air pollution. And that's a larger topic for discussion that I can sort of really cover here. Another question I see is about can the address histories from StatsCan tax filing data be linked with CPTP participants via coded participant ID to obviate or clarify participant provided residual histories from the court? So yes, it can. We have done that, but not participant ID. I forget what the exact linkage is. I think it's essentially name and birth date are some of the key things that allow us to do that linkage with quite a bit of success. But certainly, the StatsCan environment wouldn't have participant ID, so that wouldn't be the linkage variable to use. But it's there, and there's even opportunities to compare between the two, what CPTP has collected versus what StatsCan derives. Another question about the Green View Index and the Street View, and about the ability to have these be updated. And that's true. The Google cars only drive around a certain amount of time. They drive around in different seasons. So it's only one piece of information. Another thing that's important to note for anything that comes from that source of data is it doesn't see greenness in people's backyards or in parks. It's only seeing what's on the street. So there are limitations. So it's only a different measure of some aspects of greenness. About the good score and the use of that in terms of children. So we are right now exploring a partnership with a not-for-profit known as Sandbox Project that is about children's environmental health. And we're also thinking about the interests and other end goals around improving the ecological environments near schools and the engagement they have with children. And we'll have certainly much more focus work to be done with children, but we feel that this is actually a way in which their phones can be used for good as opposed to leading to nearsightedness and other distractions to educate them, and I think make them aware that they can make choices about how they get to school, what routes they take, and they're not helpless in being impacted by the environment, and that they can also make a difference in terms of, with the knowledge, communicating to officials about that. So there is, I think, those components that we can build upon further. I see a question about, is good quality cancer outcome incidence mortality available to associate with environmental exposures? Yes, it is. I can't really speak to what's in CPTP at that time in terms of cancer and follow-up, but the CANUE data and earlier versions of the CANUE data have been linked to the National Cancer Registry for quite a bit of research on cancer and environmental exposures, generally based again on a 6-digit postal code. question about the types of apps that are available for collecting activity data. Are they commercial apps developed by, or being developed by researchers? I think that's part one of the question. I think that they do vary in terms of that. Anybody can carry a GPS, and we have GPSs on our phone. And right now, we're working with Zach Patterson at Concordia University to develop the software to read in all that information and refine it, make sure it's accurate, and then identify key things like where's their work location, home location, are they more likely that they're traveling by mass transit or by motor vehicle, that sort of information. And I think there's different models possible with respect to how that would be processed that we're still working through as to whether or not it's better to have a third party do that versus do it in-house. And the former could incur additional costs. And so we should explore that further, given that you say there may be an opportunity to pilot this. But knowing what's happening in other places in the world, I think the Europeans have been really on this a lot more than us from some of their previous work under the Exposome funding. And Danny Douin, who worked with one of the leaders in that area in Switzerland, and I are certainly wanting to engage with them more because they're now starting to actually use them in cohorts. So some are definitely ready for that, and I think could be done pretty quickly. There are certain things to work through with respect to making sure participants are comfortable sharing that information, and it's always sort of a double standard, and that lots of information they share and they don't even know they're sharing it. They tell them that they need a new washing machine. And when we try to be upfront about what we're doing, then it sort of raises alarm bells. But we certainly have good intentions, but good intentions aren't always all that it takes. Another question about is there any plans of possibly collaborating with research databases that collect biological information, genome sequences, microbiomes to determine gene? Yes, for sure. As we build the data platform within the child cohort, there's much work on microbiome. And we've been working with some in the child study now with the greenness data that we've been generating and their gut microbiome data to look at associations between proximity to greenness and the diversity within the gut microbiome. So those are possibilities that are definitely there. The child cohort is where I've been more active. I'm aware of it. I'm not sure with respect to CPTP what could.
Oh, I think we might have lost Jess there. I see that there's one question left around the Good Score City application, so I'll make sure that that question is answered, and I'll share it widely on our social and website as well. So I think we're right at time, so I'll close it here. To all webinar participants, thank you so much for joining us. You'll receive an email the next day or so with a survey as well as a link to where you can access linked CPTP CANUE datasets. So please do look out for that email from us. Jeff, on behalf of the CPTP National Coordinating Center, thank you so much for sharing your time and your expertise today. One last thing, I will just sort of note that there's lots of really exciting news and events and announcements in the next month or so coming from CPTP. So,
sorry, hello, I'm back.
Hey,
something happened. I got cut off, but anyway, it sounds like we're out of time for all the questions. But so yeah, unfortunately, my apologies. Something cut off my signal.
Oh, no worries at all. There's just one question left, but I'll connect with you offline to make sure that we can get it answered publicly. And I was just saying to everyone, there's lots of exciting news coming up in the next month or so with CPTP, so please do follow us on Twitter and on social if you're not already. Thanks again, everyone. I hope everyone has a great day.
Yeah, very much appreciate the invitation. Happy to address any questions through CPTP or through CANUE. Have a good afternoon or morning.